Thank you so much for that kind introduction and also just for inviting me here today. I know some people are joining us today and others will be watching this later. So I just really welcome and appreciate everybody who will see this presentation. Today I'm going to speak about asylum medicine, the role of the clinician. And asylum medicine is practiced by physicians and other clinicians, and I might use the terms interchangeably, physician and clinician. I will say that there's a lot of difficult content in this presentation, things that we will be talking about, as well as photographs and diagrams. So I just bring that up before we start. Some of it might be difficult to hear and to watch. I have no conflicts of interest or disclosures. Excuse me, I have a little bit of allergies though. So today I'm going to speak about historical and legal background of asylum. I will discuss criteria for gaining asylum. I will talk about performing medical evaluations of asylum seekers, and then review different forms of torture and persecution and common related scars. Let's begin by talking about historical and legal background of asylum. Much of my talk will be US-centric, but it is very much informed by international law, international policy, and also by, many historical precedents as well in the course of humanity. So I am most familiar with the US legal and medical system, but I think that many of the things we talk about can be generalized to different times in history, as well as different parts of the world today. So I always find this to be a very striking photograph, the ancient history of asylum. And this is called the sanctuary ring. It's on the door of Notre Dame Cathedral in Paris. During the Middle Ages, grasping this ring gave the person the right of asylum. So you can see that through the course of history, people have left places that they live and traveled to another place to seek safety from danger, from persecution, from injury that they might be experiencing. So people have fled, have a history of fleeing places where they're in danger for thousands of years. There's so many people in the world today who are asylum seekers, who are internally displaced, and who are refugees. So the work we do continues to be very important based on geopolitical disruptions and events and wars, as well as conditions in places where people currently live. So I always thought this was an interesting story. This is not about my family, but this is about an acquaintance of mine who is someone I was talking to about my work, a layperson, not a clinician. And he said to me, "What are your thoughts about an immigrant crossing the border illegally, coming into your country illegally? He's an alcoholic. He has worked for a terrorist organization in his home country, and his English is rudimentary." So this is something that I might say to some of my fellow citizens who would be astonished and aghast, and they would say, "Oh my gosh, this is the type of person who we don't want in our country. How can we even consider letting this person cross our border and begin to live in the United States, in our country? He's got, obviously lots of problems." And my friend said, "In fact, that's my Irish grandfather." So this is, again, a man who is an acquaintance of mine, and he is actually very successful. He's a successful professional. He is educated. He has a family in this country, but in fact, one of his ancestors came to this country, the US, with many, many problems. He was a tough man who was a member of the IRA from County Cork, Ireland, with a drinking problem. So I'm not saying that this is necessarily the person that you would, on paper, want to enter your country, but I'm also saying that people who come to our country, asylum seekers, immigrants, refugees, they're humans. They are not perfect. And in fact, ultimately, they can contribute to society and they can build families that contribute as well. So the people that we see in asylum medicines are those who have scars. And in asylum medicine, in this field, we are clinicians, physicians, psychologists, social workers, psychiatrists. We are people who have clinical training, and we use that training to assess those who have been persecuted or tortured, understanding that torture is considered to be a form of persecution. They are coming to our country, they are seeking asylum, and when they come to us, asylum medicine professionals, what we are doing is trying to gather objective evidence in the form of scars, physical or psychological, that they claim are related to the persecution. So this is somebody who is persecuted, who's seeking asylum, and in order to bolster their claim of persecution, they may have scars of some sort. This is obvious. This is a man who had been tortured in his home country. This is obviously a very dramatic scar. Not all the people we see have these scars that are quite so dramatic. I came to this work about 15 years ago at Yale, where I'm an internist. I'm a general internist, general internal medicine, and I've seen patients in my practice for years at Yale, and just somewhat coincidentally, my practice now is comprised mainly of a population of patients who are underserved. Many of them are marginalized in society. They are impoverished. But I also am part of the refugee clinic at Yale. So many of the patients I see are resettled refugees, new refugees to this country. And so that's my patient population whom I care for. Now, asylum medicine, also where we perform these forensic medical evaluations, these are, this is a clinical situation where we actually are not providing care. We are gathering forensic evidence of scars related to persecution. So again, the way I came to this is I had my practice at Yale, and a colleague said to me, just kind of serendipitously, or just out of the blue, she said, "Oh, would you be interested in ever performing forensic medical evaluations?" Well, I didn't really know much about them, but I said, it sounds kind of interesting. So she helped refer, or she had a person who'd been referred to her and she couldn't see him. So she asked me, did I want to see him? And that's where I started. Started that work on my own initially, and then have since, in the last 15 years or so, recruited other faculty members who perform these evaluations. We have a group of internists who perform the physical forensic medical evaluations. We have a group of psychologists and psychiatrists and social workers who perform the mental health forensic medical evaluations. We have gynecologists who perform gynecologic evaluations, and most of those are for survivors of female genital mutilation cutting. And we have pediatricians as well, and they see children who are seeking asylum. So we have gathered this group, Yale Center for Asylum Medicine, and Yale Center for Asylum Medicine. Our goal is, number one, to see clients, and we call them clients, not patients, because we are not providing medical care. We see these asylum seekers, and so our goal, our mission is to perform the clinical work of gathering forensic evidence. We also have a very strong and robust educational program. So we have Yale medical students and nursing students and residents, fellows, all of whom are interested in doing this work. And so they assist with the evaluations and assist with writing the affidavits and so on. We train them. And so really clinical work, educational work at YCAM, Yale Center for Asylum Medicine, but we also do some scholarly work. So we do have some studies that we perform, some scholarly writing, reviews, and we also perform some advocacy as well. The sense of modern asylum is probably stems somewhat from this document that was written shortly after World War II, the Universal Declaration of Human Rights, a UN document. And the idea, as I understand it, kind of stemmed from all the refugees that resulted from World War II, during World War II, and then after World War II. What should be done differently for people who are fleeing for safety? And the Universal Declaration of Human Rights addresses that in a way. And some of the articles in the Universal Declaration of Human Rights especially pertain to asylum and refugee work. Article 5, no one shall be subjected to torture or to cruel, inhuman, or degrading treatment or punishment. So that addresses the torture aspect. And again, as I alluded to before, torture is considered a type of persecution. And Article 14 says everyone has the right to seek and to enjoy in other countries asylum from persecution. So that is kind of what this work we do, which is clinical from my perspective, is rooted in. International policy, international tradition, international law. So what are criteria for gaining asylum? And again, I will talk about US law as much as I know it. I think that there is a lot of similarity with Canadian law. I'm sure they're not identical. And as a clinician, I certainly am not an expert in legal issues, but I will talk about it in a very general way. Legal criteria for refugee and asylum status in the United States. In order to be granted refugee status or asylum status in the US, an individual must prove that they have been subjected to persecution that is perpetrated by the government, or in the setting where the government is unable or unwilling to provide protection from that persecution. So people certainly can be injured, for example, but if that injury is not related to something involving the government, it doesn't fit the legal criteria for refugee or asylum status in the United States. This persecution must be perpetrated based on certain criteria, legal criteria, and those include a person's race, religion, nationality, political opinion, or membership in a particular group. So 5 particular protected groups who can claim refugee status or asylum status. And the membership in a particular group legally refers to gender-based violence, which might be domestic violence, gang-related violence, LGBTQ violence. Some more aspects of gender-related violence include female genital cutting and mutilation and forced marriage. So that doesn't describe all the people within that category, but it gives you an idea. And the thing that I've become aware of as a clinician is that often the persecution that occurs because of membership in a particular group is not necessarily perpetrated directly from the government. It's where we think about, let me just go back to the previous slide, where the government is unable or unwilling to provide protection from that persecution. So we see a lot of people in our clinic, a lot of clients in our clinic who have been subjected to domestic violence. Well, it's not the police or the government who's coming in injuring. It's usually women in this case. It is their partners, and the government is unable or unwilling to protect that person from this form of gender-related violence. Again, in this country, and there might be some similarity in these other countries that you all are from, refugees and asylum need to both meet the same criteria, legal criteria, persecution based on one of those 5 groups. But the timing of the legal status is what distinguishes the two. Refugees are granted legal status before entering the United States, and asylum seekers are granted it after they enter the United States. So asylum seekers actually have many fewer protections and rights when they come to this country. They have to spend the time in this country before they're granted asylum in a more precarious situation than a refugee is in. So this is where we touch upon the relevant things from my perspective as a physician, as a clinician. And this is what I alluded to a short time ago, and where my colleague said to me, do you want to perform this forensic medical evaluation of an asylum seeker? So as a clinician and a physician, we are guided to do these forensic medical evaluations by this document called the Istanbul Protocol, which was just revised, I think, a year ago. Maybe I think the most recent revision was 2023 or 2024. And it gives us guidelines about how to perform these medical forensic evaluations. And we refer to it a lot, and it kind of standardizes what we do, how we gather the objective evidence. So you'll hear about the IP, the Istanbul Protocol, a lot when we talk about asylum medicine and forensic medical evaluations. At our particular program, we receive referrals from various legal entities. So we work a lot with academic legal clinics. The University of Connecticut, New Haven, where I am, is in Connecticut. So we work with UConn Law School. Every year they send us several asylum seekers to perform these forensic medical evaluations on. Yale as well in New Haven will send us. We've had referrals from Columbia School of Medicine. So a lot of academic legal clinics offer pro bono legal representation to asylum seekers. And some of those asylum seekers whom they represent would benefit from a forensic medical evaluation to document scars. We work with a lot of immigration attorneys. Some of the immigration attorneys are in private practice. And again, you know, at any given year, we will certainly receive referrals from immigration attorneys. And then we work with a lot of human rights groups, Physicians for Human Rights. That's probably Physicians for Human Rights. That's probably our strongest partner at YCAM. And American Friends Service Committee, we work with them a lot for clients who are detained. Connecticut Institute of Refugees and Immigrants. So a lot of different human rights groups are sources of referrals. So this is a photograph in an exam room in my clinic, and this is me, and this is one of my students, and Dr. Farhadian is her name, and we are interviewing this man who is an asylum seeker. And he is a man who was a citizen of the Democratic Republic of the Congo. And I just found it very interesting because it's when I met him and when we worked with him, it just brought to my, it seemed to me such an interesting example of human rights and our common humanity. So he was this business person working in the DRC, and you know, he was very unhappy with the autocratic government that was in place at that time, and he felt that they were corrupt and unfair, and country conditions at that time backed that up. And so he went to a political rally one time. He thought, you know, we need to have a change in government, and I'd like to protest against the current government, which is something that we, you know, in the United States, take for granted, that we can have free speech and there will not be repercussions for peaceful protest. So he went to this protest that was peaceful, and he and many of his fellow protesters were summarily detained, rounded up, detained, and he was placed in detention for 5 days. And while he was in detention over those 5 days, he was tortured multiple times. So when he was finally able to leave detention, you know, not everybody is able to leave detention. Some of the people who had been there with him were actually killed, but he was able to be released. As soon as he was released, he immediately went into hiding and began to plan his escape from the DRC. And ultimately, he was able to escape. He was able to get a visa and fly into New York City. And once he arrived in New York City, he found legal representation at a town near New Haven, where I live, in Bridgeport. And he was able to find an attorney who worked through one of those organizations I just referred to, Connecticut Immigrant and Refugee Institute. And he found legal representation, and his attorney reached out to YCAM and said, "This man was tortured in his home country. He has physical scars. Could you please perform a forensic medical evaluation?" So that's really the background of what we did. Dr. Farhadi and I met him. We listened to his story. We'd already read the declaration that his attorney had written. And then we began, this is a different asylum seeker, but then we began our physical evaluation on him. And this is another one of my colleagues. And what we do is we, using photographs and using a measuring tape, we look at every scar, we photograph it, and then we write an affidavit based on our discussion with the asylum seeker and what we noted on exam. When we produce this affidavit, our affidavit, at least from a physical perspective, almost always includes photographs and even sometimes body diagrams. So you might see on this slide on the left, this was a woman who had been a survivor of domestic violence, and her husband had cut her repeatedly with a knife one time when he was injuring her. And so we will look at each of these scars and we will document them and measure them. On the right is an area on a scar on her forehead from when he threw a broken piece of pottery. So what we'll do is we'll measure them, we'll describe them. We often include in the affidavit these body diagrams, localizing exactly where the scars are. I'll go into a little bit more depth about this. This was a man who had been detained as well. And as he was being detained, he was beaten, and some of his the soldiers who had detained him, they had these steel-tipped boots, and they kicked him repeatedly. We think of that as blunt trauma, and that blunt trauma resulted in these scars that we saw him. So we're very evidence-based. We're very objective. We might say scar number 1 was 6.5 centimeters long, 4 centimeters wide. It was flat and oval-shaped scar with irregular pigmentation and sharp borders. It is on the medial side of the right leg and is consistent with the scar from blunt trauma. So you might notice with each of these scars, we end up saying whether it is consistent, highly consistent with the injury that is alleged by the client. And we can talk about degrees of consistency in a minute. But this is what we include in our affidavit. We include how the client describes their persecution, and then we include what we find in terms of the physical scars. We can go back and talk about the Istanbul Protocol that I referred to just a few minutes ago. So the Istanbul Protocol, the IP, gives us direction about how to describe these scars, and has really written a taxonomy of consistency. You can see on the left, and I'll go ahead and just read it. We might see a scar and we will describe it as not consistent with. And this is, in our medical opinion, based on the evidence we see, the lesion we saw on exam could not have been caused by the trauma described. So maybe we'll say, maybe this man said, "I was cut on my leg with a very sharp knife." And as an internist, I say, you know what, in my medical opinion, that scar is not consistent with sharp trauma. I would say most of the scars we describe as consistent with or highly consistent with, but of course there are exceptions. So consistent with is described as a lesion that could have been caused by the trauma described, but it is nonspecific, and there are many other possible causes. Again, these are definitions from the Istanbul Protocol. Highly consistent is similar. The lesion could have been caused by the trauma described, and there are a few other possible causes. And then there's typical of. This is an appearance that is usually found with this type of trauma, but there are other possible causes. And then diagnostic of. This appearance could not have been caused in any other way than that described. Again, rendering my expert medical opinion. Not the best slide, but this is what our declaration looks like. The declaration of me on my letterhead, the date it was done, the medical evaluation. It starts with my credentials, who I am, what my training has been, what my background is. You have to establish for immigration court that you do have some expertise in this field. And then you go into the events described, the physical findings, and then your conclusions, a medical legal affidavit. This is a very difficult photo to see, but this is a man who had been beaten repeatedly when he was in detention and the scars that resulted from that. I just show that as part of this slide, but I want to point out that the work we do, these forensic medical evaluations that we perform, they have definitely been shown to be effective in immigration court. They are useful for people who are seeking asylum for the most part. In fact, a retrospective analysis initiated by Physicians for Human Rights, looking at cases between 2008 and 2018 that included forensic medical evaluations, found that 81.6% of applicants for various forms of immigration relief, including asylum, were granted relief as compared to the national asylum grant rate of 42%. So about twice as likely to be granted asylum if you are fortunate enough to have a forensic medical evaluation. These FMEs are useful and effective. I'll just finish by going over some forms of torture and persecution and some of the scars that are related. And again, this is where things become a little bit difficult at times. But we kind of think about blunt trauma. When somebody is detained, when they are persecuted, when they are tortured, blunt trauma is often used. And this can be in the form of somebody who has boots and they kick somebody for a long time, repeatedly. It can be in the form of somebody who has a weapon that they use to beat somebody. So when you see the photo on the left, this is a fairly classic example of a scar that shows blunt trauma. And it was due to somebody kicking this man's shin repeatedly. And this was the scar that resulted. And in fact, a fairly typical scar for that sort of trauma and injury. The man on the right was hit repeatedly on his left arm, which is on the right side of the photograph. And he was hit so hard that his arm was fractured. He did not have access to any medical care, so he never was able to have his arm fracture splinted and cared for appropriately. So when it eventually healed, and we saw him about 2 years after this occurred, his left arm was chronically contracted and shorter on the left side, on his left side, our right side, from the trauma versus the normal arm on the right, on the left side of the photograph. So these are some examples of what can happen from blunt trauma, which again is commonly used when people are detained, tortured, persecuted. We have to kind of familiarize ourselves when we do this work with how certain scars can appear. So this is a photograph, and this is of a man who was in detention, detained, and he was burned repeatedly with a cigarette. And you can see these small circular scars that resulted from that. And so we'd probably characterize this as a typical, on the Istanbul criteria, as a typical finding of scars. This was a man who was detained, and the people who were detaining him were using a sharp instrument. It was a knife, and they cut him. So this is an example of a scar you might expect from sharp trauma. Again, trauma that we see a lot, injury that we see a lot, and you can see it's kind of a linear raised scar. It looks different than the scars of burning. It looks different than the scars of blunt trauma. There's other forms of torture that are used, and some of these are called forced positioning. And people may be suspended. They may be forced to stand in one position for hours at a time. They may be forced to be in small enclosures. And interestingly, scars related to skin are not seen as a result of this form of torture for the most part, but we might find functional abnormalities. For example, the man on his left who's suspended, when he might see me in the office, I'll see that he has the inability to lift his arms, his shoulders in a normal way because of the chronic dysfunction that he experienced from this sort of torture. So I can document that even though it's not an actual scar on his skin. Forms of suffocation. This is waterboarding. Also doesn't usually result in any scars on the skin, but it can result in occasionally some sort of pulmonary issues. Somebody who has developed chronic pulmonary issues, lung issues after this occurred. Harder to document than the scars that we see on the skin. We talked about criteria for gaining refugee asylum status based on gender-based violence. And part of that is female genital mutilation or cutting. And this is defined as all procedures that involve partial or total removal of the external female genitalia or other injury to the female genital organs for non-medical reasons. And the WHO has defined different types of FGMC, but they are criteria for being granted asylum. So I want to just finish, and hopefully we can have somewhat of a dialogue, and certainly open to any questions. But I really want to, again, center and ground the work that we do in asylum medicine, performing forensic medical evaluations in the basis of human rights. And we really, here's a word cloud. We really feel that everybody has a right to be free of torture and persecution, and everyone also has should be protected and offered safe haven if they are being threatened or in danger in their own country. So that kind of what drives the field of asylum medicine. I also am inspired by this quote from the ancient Greeks, from Aeschylus. It seems that in the world today, just as in the world for thousands of years, there are people who do not respect human rights, kind of a modern concept of human rights, and who erase the humanity of their fellow people in various ways. But as Aeschylus said so many years ago, our goal is to tame the savageness of man and make gentle the life of this world. So that's certainly a quote that often inspires me, because the work we do is, it's very hard at times, and you often feel that you're not making a big difference, but certainly in many times, especially with asylum medicine, we can make an enormous difference in an individual's life. These are just some photo credits and references.